Community Speaks, a new show brought to you by the Roxbury JP Substance Use Coalition. If you haven't heard of us, we're a community group focused on decreasing the impact of substance use in Roxbury and JP. My name is Chioma Inaji, and I am the coalition coordinator. On this show, we will discuss the truths and the myths about substance use in our community. You'll hear from members in our community who are struggling with recovery. You'll hear from members of our community who work every day to do something about this issue. Upcoming programs will also focus on showcasing some of our coalition members, some of the organizations that we work with. We will talk about youth and how substance use affects youth. We'll talk about how race and poverty influence what's happening in our community. And also, you will get to meet local providers who can help you if you're dealing with substance use or if your family member or someone you love is dealing with substance use. So please join us the second and fourth Thursday of every month. So I want to introduce our guests for today. Today we have on the show Skip Lewis and Margaret Noyce.
Hi.
Welcome. How are y'all doing?
Good, thanks.
Good. Both of you are long-standing coalition members,
Yes.
right? And so you're going to talk to us today about what's going on with the coalition, why is it important for us to talk about substance use, and I also want to hear about why you decided to get involved. So first, can you give us
Margaret, go first.
a little bit information about who you are, what you do, and
Sure.
yeah.
My name is Margaret Nose, and I've been a resident of Jamaica Plain for 40 years now.
Oh, wow.
Raised 2 kids here. And I am the coordinator for the Jamaica Plain Coalition Tree of Life, which is a coalition of health and human service providers and residents. And we work to support families and seniors and to address issues of public health that are brought to us from the community.
Now, where are y'all located in JP? Because I know it's close.
Our office is right in Bromley Heath at 295 Center Street.
Right.
And we recently opened a family resource center right across the street on the corner of Ritchie and Columbus Ave.
Right across from
Jackson Square. Yeah.
And Skip, can you tell us a little about who you are?
Sure. My name is Skip Lewis. I've been in the community for over 55 years.
Yeah.
And I'm the executive director of Second Chance. And we work with youth from ages from 13 on up. And we have a reentry program. We help brothers and sisters who were incarcerated and are on their way out. And we help and provide them with essential services.
Wow, that's excellent work. So not only are you all long-standing coalition members, but together, I sort of did the math, 55 plus 40, together, y'all got 95 years of
Community, yeah.
Well, this is a passion.
Yes,
This
yes.
is a passion for me. This is a passion for me because I've been in the community all of my life.
Yeah.
And I've seen the ups and the downs, and
Yeah.
I've seen what substance abuse has done to our community.
So can you share that with us? You know, what are you seeing are the exact impacts of substance use? Because a lot of people don't, you know, make some connections, right?
Yeah.
So what do you see are some of the exact impacts?
What I see with substance abuse is barriers to entrance, barriers to enter the workforce,
Right.
barriers to enter housing, barriers to enter education, barriers to enter upward mobility.
Because people are using?
Exactly,
Or,
exactly. And I see youth as young as 12 and 13 years old smoking marijuana and drinking nips, which leads further down that path of destruction.
Right.
So what my role is when I see that, my work is so passionate that I can't help but go and try to reach out to these brothers and sisters.
Right.
And we're not only talking about the males, we're talking about the females also. And that's where it gets a little jaded because a lot of people just concentrate on males. But sisters need help also.
Yeah.
Because they're right in that mix. And there's not enough programs for young, urban kids.
Right.
There's not enough programs.
Right.
So we need everybody. This is one of the reasons why I joined this coalition. Because in strength there's numbers.
Definitely, definitely. Margaret, are you seeing some of the same
Some of the same
issues?
things.
Anything else?
We deal a lot in, we do a lot of work with DCF families, Department of Children and Families, and almost all the families that are having issues where their children have been taken out of the home, there's substance abuse somewhere involved in the, it might not be the cause, but it's involved, and it's definitely a hindrance of getting their children back. It also is a major problem for the children is when they're dealing with substance abuse in their family, whether it's their parents or an older brother or sister. It really puts a strain, and we see a lot of kids who have a lot of trouble in schools,
Yes.
and they have behavioral problems, and they're being,
They're
disciplined
acting
and
out,
acting
yeah,
out,
yeah.
and so that whole issue of just starting out was in this problem. So that's why I joined, because I really thought this was a good place as a community issue that we need to focus on the family also, not just the active users, but the people who are also affected by it, not just the users.
I think that's a very, very important point, because often
Yes.
when we talk about substance use, we're just talking about the person who's using, right? We're not talking about, they have to go, sometimes they go home to a family, sometimes they are using and still taking care of a family,
Exactly.
right? And so what is the impact on those family members with someone who's using, who may or may not be reliable, may or may not be getting to some other things, crimes related to substance use, right? Can you all talk a little bit about?
See, that leads.
Yeah.
See, that's a conversation that it's like a cycle.
Right, a vicious cycle.
It's a like a merry-go-round, and it just
Right.
keeps going around and around until that cycle is broken.
Right.
Not only domestic problems come out of that right there, but you hinder small children. You never give them an opportunity to grow, because behavior. Once they see mom and dad doing a particular thing, and then they look outside, if they don't have any mentorship, then that behavior is going to be
Right. They reflect what they see.
Exactly,
Right.
exactly.
It's a learned
Right.
behavior.
exactly.
Yeah,
But it's very easy for that behavior to be unlearned, just as well as it was learned. But we need folks that are in the community to do like when I was growing up. When I was growing up, everybody was involved in your
Right.
issues.
All in your business.
Everybody. Everybody.
That's
They was
right.
looking out
Everybody
the,
was in your
they was
business.
looking out the windows,
Right,
and
right.
they was telling on you and stuff.
That's Mary Jo's son right there.
Yeah. But see, that right there, that disconnect,
Yeah.
we don't have that anymore.
Yeah.
You can live beside somebody
Yeah.
and not even know who they are.
That's true. This disconnect that we have within communities, definitely. I know you talked about marijuana, right? You're seeing young folks using marijuana. Now, is marijuana really a substance that we're talking about? Is it really a drug? That's the question.
Well-
Is it really a drug, and should we really be concerned about marijuana?
Well, I think we need to be, anything can be a substance that's abused.
Okay.
Exactly.
And I think, because of the status of marijuana right now and the uncertainty of, like you said, is it a drug or not, that we see an awful lot of kids really, really abusing it, just like alcohol.
Exactly.
Alcohol in and of itself is not necessarily a drug or a substance, but if you can abuse it,
It's legal.
it's legal. But tobacco, you can abuse.
legal.
Yeah, I know.
Yeah.
So,
yeah.
but you can abuse all of those.
Right.
See, and that's
right.
the fallacy, Margaret, about marijuana, because marijuana does have some medicinal purposes.
Right,
But if
right,
you
right.
go back
Right.
into the 20s and the 30s and the 40s, when they used cocaine, and they put cocaine in your drinks,
Right, right,
and
right.
they used cocaine for your tooth extractions and
Right, right,
everything.
right.
That was okay until people started getting
Get
addicted.
addicted. Yeah.
And then once they started getting addicted, it became a whole new ball game. With the reemergence of marijuana smoking now, it's almost like a rite of passage in certain communities, because they're inundated with it on the radio.
Right.
They're inundated with
The
it on
music,
TV,
the TV.
the whole genre.
Right.
The whole
right.
genre. It's like a culture.
Right.
But it's not cool to not smoke. And when you see young kids that are being snatched away from it, they have the hardest time trying to go home because they're not with the in crowd. We need to dispel the in crowd. We need to disperse them. We need to get rid of that in crowd because it's our kids
Right.
that are dying. It's,
But is it only kids that are smoking marijuana though?
Oh, no.
Okay.
no,
So I know that we talk a lot about wanting to do sort of prevention, right?
Yes.
So we really want to prevent youth from even starting.
Right.
Exactly.
Whether we talk about marijuana, whether we talk about alcohol or some of the other some of the hard substances, right? But often we don't talk about the impact of marijuana with older adults, right? That we see some of the same behaviors.
Exactly.
Addiction.
Exactly.
Yeah.
Exactly.
Yeah.
And that kind of strengthens what we do as a coalition around our focus groups when we talk. I mean, and we talk in ad nauseum about it and about preventing
Right.
that right there.
Right,
So
right.
I'm happy I joined the coalition.
Yeah. We're happy too. Right, Brian? We're happy. yeah, excellent. So moving into some of the work that the coalition has done, both of y'all talked a little bit about it, your reasons why I joined the coalition. So what's some of the work you've got into as it relates to the coalition? What's some of the work that you've done?
Well,
Yeah, I know the coalition has done a lot.
Right.
Yes.
Yeah.
Well, for the last 2 years, the JP Tree of Life and the Bromley Heath Tenant Management Corporation has been sponsoring the prescription drug takebacks.
Right, and Bromley Heath
And
is
Bromley-
a member of the coalition.
Yeah, that's right. And last year, I mean, those are one-day events. And last year, we said we wanted to do more than that. So we trained 4 youth from Bromley Heath
Oh, wow.
around the dangers of what is a prescription
Prescription
drug,
drug, right.
and what are the dangers and why it's important to have a safe disposal.
Right. Can you talk a little bit about that? So why is it important for
Well,
us to
there's
deal
a-
with prescription drugs? I mean, they're
'Cause-
prescribed, so why
Right.
do we, loop it
Right.
into substance use?
Right now, a lot of youth, that's their first entry into some of the very dangerous drugs. They'll go in the medicine cabinet and find the drugs. It's also an easy one for young people to sell to other kids, especially like the Ritalin and stuff like that. So it's very easily accessible and easily sold, and sometimes they don't understand that it's a prescription drug, so it must be okay.
Right,
Again,
right,
that's
right,
another issue that education that we have to deal with.
And so why is it
so-
important for us to dispose of them?
Because a lot of times, you'll go to the doctor, you have a tooth taken out, and they'll give you some codeine or something, if you had some major, and you don't take it all.
Right.
And it just
Exactly.
sits in your
Because you don't want to
cupboard,
get addicted to codeine.
it, right.
That's a whole
But then you
nother-
don't throw it
right,
away,
right.
and you don't want to throw it down the toilet because it's not good for the environment. So
Right.
and then one of your kids or one of their friends comes over. Oh, look at this! This would be a fun thing to get high on. Or
Right,
something
right,
like that.
right.
So
We're a pill society.
we are.
We take a
That's-
pill for
absolutely-
everything. We got a pill
are.
for this, we got a pill for
Your
that.
nose itch, take a pill.
Yeah,
right.
So
Right.
Right.
when the ailment that you had, that the pill was prescribed for, when that's over with, you generally have an excess of pills.
Yeah.
Yeah.
So a child, as curious as they are,
Yeah.
they're gonna, they're gonna take it.
Yeah.
And then once they take it, they find out they get an effect from it.
Sometimes,
Yeah, right.
sometimes they
Yeah.
don't even understand the
They
fact
don't.
that
They don't.
Yeah.
And then once they explore, and here they're going back to another, into another, into another, and then once they pick up on it, then they're buying it in the street. Now they're on the hunt for a particular type of drug.
Right.
So
right.
prescription drugs, and to get back to your marijuana question for a moment, that it was okay back in the day, but now we can say it's good from a medicinal purpose, but then on the other side, in areas, in certain communities, it just breaks down the human brain.
Right.
It makes them more lethargic than we really want to understand.
Right.
They wake up in the morning and they use, and then it just repeats itself all day long.
I think, you know, it gets to a point, when it gets to a point where you use and you cannot function,
Yes. Yes.
there's the issue.
Right,
Yes.
absolutely.
Yes.
You know, and I think people play around with this sort of, oh, well, I'm using marijuana, it's healing, it's doing this for me, it's doing, and they're not really realizing that you needing it every day before you even brush your teeth.
Right.
You know, then
Right.
2 hours later before you take your breakfast, you know, we need to look at that. Is that addictive
I think
behavior?
it's similar
That's
to
psychological.
Right.
Yeah.
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 To alcohol though too. I mean,
Alcohol is addictive.
alcohol
Alcohol
and
is
marijuana,
addiction.
but
Yeah.
but young people's brains are different. Their chemistries
Yes,
are
yes,
different.
yes,
And
yes.
Yeah.
so when they start, I mean, it might be okay to have a drink when you're old, when you're your brain is fully developed. But if you start when you're 12 and 13, same with
And you know, guys,
marijuana, it's just
Yeah.
your brain is just
Yeah.
Right,
soaking
right,
it in, and
right.
so we have
And it
to
cannot,
really-
No,
Right,
you
can't
It's
do anything
no.
without it.
Right,
It gets to a
right.
point.
This is
Yes.
why we need prevention.
Yes.
Right, right.
This is why we need
Right.
more prevention.
Right.
We need more help
Right,
with our youth.
right,
And-
absolutely.
And I applaud you in terms of you working with the whole family.
Yes.
Because
Yep.
a lot of times, if you can work with the whole family, you can pretty much cut the root
Yeah.
in terms
Root
of how,
cause, yeah.
yeah, of which route the kids are going to take.
Right.
Right. So I know that you were talking about the work you were doing with the youth out of Bromley Heath. So have you seen an impact in terms of those youth? Like, are they going out talking to their peers?
Yes,
Are they trying to get?
Yeah.
Yeah. What?
And right now, because of a lot of the work they were doing with us, and we've moved on to saying to the city, you know, with one day is not enough.
Yes.
One day,
Yes.
wonder at, you know, we
Right.
need
One day in June, right?
Right, one day
Right.
in June.
Right.
We need more than that. So we've been
Right.
working with and really trying to push the powers to be,
Right.
so that we have a place where we can dispose of the drugs
On a regular
on a
basis.
regular basis, the same
Right.
place.
So like a kiosk sitting
kiosk.
somewhere.
Right.
Right.
Right. And
So-
what are some of the other initiatives that could come out of a prescription take back sort of initiative?
Well, just the whole education piece. I mean,
Mm-hmm.
most, like I said, most people don't understand that, you know, that these are dangerous. They can be.
Right.
We don't hang on to them.
Y'all have some excellent partners, right?
Yeah.
Right? Is it Children's Hospital?
Children's Hospital,
Yes.
yes. The pharmacists at
Yes.
Children's
Yes.
Hospital have been wonderful. They're really willing to do a whole lot more. So we're hoping that, you know, once we get the go ahead on these kiosks,
Yes,
that we're going
yeah.
to do a real education campaign.
Yeah, that would be excellent. And what are some of the other things? Skip, what have you been involved in with the coalition?
Well-
what the coalition's doing?
I just love the work that we're doing.
Yeah.
And as you know,
Yeah.
I'm pretty vocal when
Yeah.
I get there. I just really enjoy being part of a positive group
Yeah.
that their target audience is kids.
Right. And I know that one of your passions in, you know, doing this work, and actually one of your passions that you've brought to the coalition is sort of the conversation around what does race and poverty have to do with substance
Yes.
use.
Yes.
So can you
Yes.
share with us a little bit about that?
You know my analogy of that is it's like a tree. And the branches, they signify what poverty and racism does to a community. And we have yet to have that conversation about race and about barriers to entrance, you know, and about education and about how it's not cool to not do drugs, but still be accepted in your community. We have not had that conversation. And once we have that conversation, I think we can move on further and really understand what substance abuse, the impact that it has on families and kids, and that learned behavior can be unlearned. And I'm a proponent of it because I know what the signs were back in the day when I grew up. You know, this particular area was for a certain group. That particular area was for another group.
What do you mean the signs? To be clear now,
Okay.
you're talking with family, so to be clear,
You see, I'm
I just
trying
want
to
to
be
make sure
PC.
everybody's
You
clear.
see, I'm trying to be PC.
Yeah, I know you're
You
trying
know,
to be PC. But we talk about this in the
Yeah, right.
coalition,
Yeah,
so
yeah.
you know we're open about these
My,
conversations.
my whole recollection of my youth was colored folks were here. This part of the section was for white folks. And if you traveled up and down the highway, and we used to go down south a lot, you couldn't stop.
And
you
you
had-
don't cross over.
No,
Right,
you-
right.
And I mean, it's a known fact. So it hasn't been that long since those signs have disappeared.
And you still see that sort of
Yes.
being separated and segmented in
Yes.
Boston. If I ask you where are the majority of Latinos, what would you tell me? You know,
Yeah.
if I tell you where are the Haitians, what would you tell me? Where are the African Americans? Where are the Africans? You know, so I think that even where are the Irish, you know,
And a
I
lot
think
of that is by
it's still-
design.
yeah.
A lot of that is by design, and that's what I'm talking about race and poverty here in our community, and it needs to be extended across the globe.
So what's the impact with that on substance use? Why is it important for us to bring that into the conversation?
Because for people of color, African Americans and Latinas, it really stunts our growth from an economic point of view, from a housing point of view, from an academic point of view. It stunts our growth. And it's making a ton of money for the people who are building jails. That's the new Jim Crow. And we have to accept it and face it and have a conversation about it. But until we learn how to talk to one another, I don't think that's going to happen. But our youth are caught up in it.
Wow. And
I
Margaret, you
also
want
just,
to?
yeah, I want to just add to that, is that, that it's so, in the race and poverty is so ingrained in us that just the, when you're sentenced for certain drugs, and the drugs that are in the black or the poor communities, you get a higher sentence than
Right.
drugs that are just as bad, just as addictive, but they're more prevalent in the white
Very-
affluent communities.
Yep.
The sentences are much lower and
Yes.
much leaner. So there's a built-in institutional racism that's going on, that's still going on in this country.
And that's why I preface
Yeah.
it with the new Jim Crow.
Yeah. Yeah.
That's
that's-
what they
yeah.
did back in the day.
Yeah.
I think that's.
If we looked sideways,
Yeah.
we got a sentence. You know, opposed to
And I think
someone else.
it links to also the availability of services
I was-
in certain
without a doubt.
communities.
Right.
Right?
And
Yeah.
I was
Yeah.
also going to say, I think the availability of treatment, there's more treatment available in the more affluent whiter communities than the African American communities. And I think we
Yes.
were talking about,
Yes.
even though we've moved on to sort of identify marijuana and alcohol as our sort of the drugs and substances that we're going to focus on. But it was very clear from people like Skip and stuff that the crack addiction is so hard to
Yes.
to overcome, and I think a lot of that is because who uses crack.
Crack.
And I
It
think if
doesn't
we
want to
look
be
at that,
addressed,
I
yeah.
think that's when we have to say, yes, there is a problem with racism and poverty,
Right.
and is something we have to look at if we're going to look at substance.
Yes.
Wow. So
Yes.
these are the kind of conversations that we have in the coalition.
Yes, we
and this
do.
is what is so exciting about being a part of the coalition. We have the conversations, but we also are committed to doing something
yes.
about it. So I want to thank Skip and Margaret for joining me today.
You're welcome.
I really appreciate this conversation. I'm glad that we have started this new show, Community Speaks, as a coalition, the Roxbury
Yes.
JP Substance Use Coalition. I do want to say that if people want to get involved with us, that you can join our coalition meetings. We meet every first Tuesday of every month at Bromley Heath, and you can join us. We meet from 10 a.m. to 12 p.m. For more information, you can also reach us at our website, roxjpcoalition.org. And we hope to see you next Thursday, where we'll be talking about our overdose prevention work. Thank you for joining us.
Great show.